bill to provide for the Federal Medical Center Oghara for related matters being now moved the second time. I beg to move. Nigeria, like many developing countries, is besieged by numerous political and socio-economic problems, and many of these challenges or the resultant fallouts are aggravated by pervasive weak health all over the country. Healthcare delivery in Nigeria has faced major challenges towards achieving universal health coverage. In all the geographical zones, access to quality health is a luxury, as it is either unavailable or very expensive. Also, the adoption of the structural adjustment program signaled a shift from a predominantly welfare scheme to the introduction of user fee and the resultant proliferation of private healthcare provision, but without the desirable quality of healthcare delivery in place to advance the health status of Nigeria. While successive government has made concerted effort to promote health equity and ensure unrestrained access to health services, majority of the citizens are still grappling with various health challenges. As an important element of national security, public health not only functions to provide adequate and timely medical care, but also track, monitor, and control disease outbreak. Research currently indicates that about 1 in every 6 children dies before age 5 in Nigeria, while evidence suggests that improved access to adequate health care holds great potential for improved child survival. Previous efforts indicate that there are substantial barriers to accessing health care in Nigeria, and this remains an important predictor of child survival. There is therefore the need for improved access to adequate health care in Nigeria through the elimination of barriers to access, as this will enable the country to achieve a significant reduction in childhood mortality, a reality which the Nigerian state has to face up to and accordingly revamp its health care system. The Right Honorable Speaker, my wonderful colleagues, Oghara in Ethiopia West local government area of Delta State is home to Western Delta University, Delta State Polytechnic Otefe, College of Physical and Health Education Mosuga, over 10 petroleum tank farms, the Nigerian Navy Logistics Command, and the Mobile 51 Command, over 20 secondary schools, and over 50 primary schools and other public facilities. Despite its dense and growing population, the nearest health facility is the Delta State Teaching Hospital, and as the name implies, it is not for the common man and cannot be said to ensure a target of universal health coverage for Nigerians vis-a-vis the people of Ethiopia West local government. The only federal medical center in the state is situated in Asaba, and it will take 3 hours driving time or more considering the situation of our roads. This hospital, when established, will service and take care of over 13 local government areas in Delta State and part of Edo State that shared borders with Delta. My constituents are in dire need of this federal medical center to fill the huge gap towards the provision of quality health service and easy access in case of emergency to the generality of the population. This bill has painstakingly noted the shortcomings of earlier health policies which mitigate against the equitability in health sector and accessibility to healthcare service in the country, and has further made provision for facilities for training of medical students of associate university, diagnosis, curative, promotive, and rehabilitative service in medical treatment. Employment of our teaming and unskilled youths is not left out. Mr. Speaker, honorable members, in view of the importance of good health to human life, productivity, and imperative to access thereto, the need for the establishment of the Federal Medical Center Oghara cannot be overemphasized. I therefore call on my ever-cooperative colleagues to support this bill to enable it be read the second time and refer to the relevant committees for further legislative action. I beg to move.
Fifth order of the day is the commencement of debate on the general principle of a bill